Let us now move to Vivek's session for today, the voice of the patient.
I hope there are people listening now.
So they will be
Back end of the day.
So due to internet, stay assured that your voice is going to reach. The recordings will be there, the live session is there, so your voice is going to reach. It is a digital era. And why to introduce, but I'll do the chief mentor at Enablers and PharmaState Academy. An inspiration to many of us here, a thorough professional, mentor and guide, having 46 plus years of learning experience in pharmaceutical industry, maybe more, and started his career as a sales cum delivery boy and went on to become the vice president of an Indian transnational pharma company. Even today, he is one of the most active pharma professionals you will find in the digital age and is being followed by many. Over to you, Vivek, sir.
Thank you very much. And without much ado, let me go to the slides. Let me start sharing the slide. Have you given me access?
Yes, sir, it should be there.
Please enable.
Hello, everyone. And today I'm going to talk to you about the voice of the patient. And that is the essence of patient-centered care using artificial intelligence and even machine learning. Has the voice of the patient heard so far? In fact, on two separate occasions, my own voice as a patient has not been heard. And that really caused me a lot of emotional distress, not only to me, but even to the members of my family. So I think it is essential to listen to the voice of the patient. About 61 years back, there was a beautiful article in Harvard Business Review, Marketing Myopia, written by Theodore Levitt. And this article totally changed the face of marketing. And he introduced a term which is called as customer centricity. And in pharma parlance, when you translate customer centricity, it becomes patient centricity. So far, right from 1907, when the first medical representative in the world was appointed by Roche, Shohei Nonomiya, way back in 1907, the focus has always been either doctor-centric or brand-centric. And there is nothing wrong in this, really nothing wrong in this. In fact, even recently, even today, the success of a brand or success of a pharma company is measured by the number of prescriptions which are given by a doctor. And if that be the case, there's really nothing wrong if the focus has been on the doctors rather than on the patient. But will it be the same in the coming years? Just imagine, my friends, who are the revenue generators for a pharma company? Apart from the medical reps, who else are the revenue generators? It is the patients. It is the patients. I know of instances, I personally know of instances where the mothers have sold off their gold jewelry to treat their child. Fathers have pawned their house so that they're able to treat their parents. And if this is the case, shouldn't be hearing the voice of the patient? The pharma industry is waking up to the fact that patients and not clinicians are its real customers. And we cannot continue to ignore this fact. That would be suicidal. If a pharma company has to be patient-centric, the change should start at the top. The mindset of the C-suite leaders, the entrepreneur, the owner of the company, that should first change. And if that has to be changed, these leaders, the C-suite leaders, the entrepreneurs, they need to be human-centric. And what do you understand by human-centric? Keeping the employees at the center of all activities. Translated into another word, it is also sometimes called as servant leadership. And if you're a servant leader and if you're human-centric, definitely your organization, his organization, can become patient-centric. And when you talk about patient centricity, all the activities of a pharma company, whether marketing, HR, finance, or even F&D, which has been beautifully explained by Sunil Attawar a little while ago, the entire focus should be on the patient. So what is the voice of the patient? Patient's voice refers to the experiences of the patients, their views and opinions on the medical treatment they receive. That actually is the voice of the patient. Very recently, I read a book, Anna Karenina, by Leo Tolstoy. What is that Anna Karenina principle? Happy families are all alike. Happy families, they are all alike. Every unhappy family is unhappy in its own way. Similarly, happy patients are all alike. Every unhappy patient is unhappy in its own way, or in his or her own way. Just a few days back, hardly a week before, there was an article which was published in Harvard Business Review. Understanding unhappy patients makes hospitals better for everyone. It was on 2nd April, it was published. And the survey results were a little surprising to me. They said that a great majority of the patients are unhappy. The great majority of the patients, they are unhappy. And this is more or less in consonance with the review, with the results of the survey carried out by Jamia University along with PharmaState. What are those unheard voices of the patients? What are those unheard voices of the unhappy patients? And I shall share a few of them from my experiences as a pharma person for 48,000 hours. Now, what are those 48,000 hours? They are the waiting period outside a doctor's chamber waiting for a call during my 47 years of pharma journey. And what are those voices which I've heard in these 48,000 hours? I would like to organize this into two. One, which is not within the control of the doctors, and the other, which is definitely under the control of the doctor. Why do I say some factors, some unhappy voices, they are not within the control of the doctor? For the simple reason, the abysmal doctor-patient ratio. The WHO recommends for every 1,000 population, there should be one doctor. And in India, if you also include the Ayush stream of doctors, that ratio is one doctor for a population of 1,350. If you also include only the MBBS doctors and above, that ratio becomes one doctor for a population of 1,800. Go a little further. Come to the super specialties. And one of the super specialty which I'm going to talk about today, and it has been talked, the number of diabetologists and endocrinologists in India as compared to the population. And when it comes to the ratio of a diabetologist, endocrinologist with a patient population, one endocrinologist or one diabetologist for a population of 1,17,500. One endocrinologist diabetologist for a population of 1,17,500. If this is the abysmal ratio, I'm just wondering, how can you blame the doctors if they are unable to give adequate time to the patients? How can you blame the doctors if he's not able to explain the prescription to the patient, if he's not able to explain the side effect to the patient? How can you blame? It's simply because he doesn't have the time. After all, a doctor is also human. He needs rest, he needs physical rest, he needs a good night's sleep so he can treat the patients better the next day. And if he isn't not able to do that, how can you blame the doctor? Empathy is missing. Of course, empathy is a subject. Neither empathy nor emotional intelligence are subjects which are taught in the medical schools. And therefore, this is another factor. If you see all these three voices of the patients which have not been heard, pharma companies can offer solutions to this by having patient advocacy groups. But what are those voices which are within the control of the doctors, which the doctors perhaps have not seen or they have neglected? For example, the seating arrangements in hospitals and clinics. Just imagine these patients, a pregnant lady or a patient with spinal disorders, he or she has been made to sit on a hard concrete seat. You can just imagine what would be the discomfort she must be facing. Lack of empathy, lack of empathy. Against this, these are the seating arrangements in a private hospital in New Delhi, and this is a pediatric hospital in Singapore, where the very, very long waiting time with the doctors. Fortunately for the patients and fortunately for the doctors, today there are apps which are available which can reduce the waiting time with the doctors, and the doctors can easily use these apps or provide it to the patient to reduce the waiting time and respect the patient's time. Yes, respect the patient's time. Impolite attendance. This is definitely within the doctor's control. And in a country where the patients, they treat the doctors as gods, the people in between, the attendants, they are really very impolite and rude. You may not see this in the urban cities, but since I have worked in rural places also, this is very, very, very common. The attendant shouting at the patient. Very, very, very pitiable. And these are some of the things which are definitely within the control of a doctor. And this is something very interesting. There was an article in Statesman. Statesman is one of the leading newspapers, the leading English newspapers in Calcutta. And this was an article which was published by Dr. Basak and Dr. Mandal. And they say that many times the efficiency of the nursing staff in Ruby Hospital, they mentioned Ruby Hospital in particular, it goes down because the nursing attendant, she's not able to understand the language of the patient, and the patient is unable to understand the language of the nursing attendant. And this problem becomes even more acute when the patient is in great distress, in a very, very, very painful condition. There are many, many other such factors. And this is where This is an opportunity for the pharma companies to step in. I love this statement from Russell John Howard. He is a pioneer in the field of parasitology, and he says the most important person in the operating room is the patient. Similarly, for every pharma company, for every healthcare professional, the most important person should be the patient. Remember, my friends, the patient of 2035, 45, 55, he will not be the same as the patient of 2021 or 1974 when I started my career, or say 1935. We'll create a persona of the patient. How will he appear? How will he look in 2035? And this person I'm creating from various data and clinical reports which I have seen. The patient of 2035, before that, I will have a small opinion poll. I would request Dr. Satish to please step in. What will be the average age of a patient of 2035 with lifestyle disease? Will it be 24, 38, 51, or 60?
Please participate in the poll. Yeah, we're getting the results. Yeah, please post your opinion in the poll.
Yes, we have another 30 seconds left.
Yeah.
We'll end at 90 seconds.
Yes. Okay, there is a good race between the first two. It's very close. Okay, should I answer?
Oh, yes. Oh, yes.
Okay, I'm ending the poll.
The election results are out.
The election results are out, and more or less, it is keeping in trend. The patient of 2035, the majority says will be in the age group of around 38. And the reasons for this are obvious. What are the reasons? Stress, strain, unhealthy eating habits, pollution. There'll be so many reasons for that. So let us see the persona of a patient of 2035. He'll be aged 38 or maybe even less than that. It could be in 30 or even 24. And a great majority of them will be having lifestyle disease. Could be diabetes, could be hypertension, could be cardiovascular problems. But the most interesting thing, he will be well informed and he will have a very high DQ, digital quotient, digital intelligence. And even before he goes to the doctor, perhaps the patient would have examined himself on some digital medium. He knows his condition. He may even know what is the line of treatment which a doctor may suggest. And when he goes there, he is ready to challenge the SCP. This is going to be the persona of the patient in 2035. And this is a reality which not only the pharma companies should realize, but even the doctors. They are to be more eager to be involved in managing his disease and would like to be associated with patients like me. Now, what do you mean by patients like me? Patients like me are those patients who have similar chronic disease conditions like me. Why would the patient like to be associated with patients like me? For the simple reason There are many distressing conditions in a patient which you would not like to relate to his near and dear ones, because that would put them to further stress and strain. He would not even like to reveal it to his close friend. Why keep them unnecessarily anxious? And there should be a channel for him to voice his problems. And who better can it be than than patients like me? And who can help here? Once again, the pharma. The patient of 2035 would like his or her voice to be addressed. And of course, this patient would like to have better treatment outcomes. And if the patient has to have better treatment outcomes, let us see who is the most important caregiver in the patient journey of a patient who is of my age, about 72 years, and has a heart disease. Let us see who is the most important person. The doctor, the nurse, the pathologist, the husband, the wife, the close family members, or the adult children. We'll run this poll for exactly 90 seconds.
Please cast your vote.
Yeah, we have a few more left. 50% have cast the vote. We the same at the polling route in the West Bengal now. Very good. The trend is very clear. Close to 70% say that it is the husband, wife, or maybe the adult children, which means that somebody from the family. We can close the poll now. Is somebody from the family.
Yeah.
If somebody from the family is going to be the most important person to take care, the only question which I have asked, how many of these home caregivers have ever been trained? And why this is important? Even a small mistake from the home caregivers, that could turn out to be fatal. So who are the stakeholders in the patient journey? There are two types of stakeholders, the internal ones, and when I mean the internal ones, I mean the pharmaceutical company. The internal stakeholders and the external stakeholder. And one of the internal stakeholder, which is very, very, very common, which I have highlighted with the yellow, the R&D and F&D. So what is the role of the R&D and F&D, and how can they become the stakeholders in the patient journey? I'll explain that toward the end of this presentation. But when it comes to external, that is those which are outside the pharma company, who can be the stakeholders? And all of you have rightly said it is the caregivers of home. 70% have said that it is the caregivers at home, either the wife, the spouse, the adult children, because that is the place where patients spend 95% of time. Hardly 5% of time is spent in a hospital or a doctor. 95% of the time is spent in a non-clinical setting. Medical devices and IoT companies. IoT means Internet of Things. For example, there is no other IoT company from Bangalore which has developed a product which is called as Doorstep, And this dose type is able to help the patient at home to adhere the patient to therapy. Now, this is something surprising, isn't it? Few company as a stakeholder in the patient journey. Just recall what I said a little while ago when we are looking at the persona of a patient in the year 2035. He is going to be digitally very intelligent, and perhaps he may know what is the line of treatment which the doctor will give. And suppose the patient of diabetes or hypertension, he goes to the doctor and the doctor immediately prescribes him metformin or antihypertensive drug. He is going to challenge the doctor, and the doctor of 2035 will know that the patient of 2035 is aware that diet and exercise, they are the therapies which should be initiated. And when the doctor initiates therapy through diet and exercise, he will certainly not ask the patient to go for a morning walk in Kolhapuri chappals or a pair of office leather shoes. He will look for therapeutic shoes. He'll look for shoes which have a soft sole. And who better can provide this than some of the good shoe companies? So a shoe company can become a stakeholder in the patient journey. Now just imagine a child, say 1 year, having spinal atrophy, and the child has been prescribed Zolgensma. Zolgensma is a product of Novartis, and can you imagine what is the cost of that dose? 180 million rupees. Now, even someone from an affluent family cannot afford 180 million for a single dose of Zolgensma. This is where the banks and the finance companies can play a very, very important role through EMIs. So you have the internal stakeholders and you have the external stakeholders. Can all external stakeholders intersect on a common platform? Who can make this happen? None other than you. When I mean you, a pharma company, the brand manager. See what an important role a brand manager, a pharma rep has to play in the coming times. My dear friends, I would like to borrow a statement from Sanjeev Navangul, and his favorite statement is transit from go-to-market strategy to go-to-patient strategy. Go-to-market strategy is obsolete. For pharma, it is go-to-the-patient strategy. Put the patient at the heart of everything. Align marketing decisions with the patient's needs and preferences. The patient of 2035 is looking for delight. Whenever we chalk out our market strategy, starts from the end. And what is that end? This is a beautiful statement, which I'm again borrowing from Stephen Covey's the book, The Successful Habits of the 7 Habits of Successful People. And one of the successful habits is to start from the end. And even a brand manager should start from the end. What is that end? The end should be patient's delight. Start with how can my strategy bring in patient delight? And if I'm addressing that, I am listening to the voice of the patient. So where will this patient of 2035 go? This is an opportunity for pharma company to fill in this gap. So let us go through a patient journey and how an ophthalmic company lost an opportunity. And I will give you my own example here. I'll give you my own example here and how an ophthalmic company lost an opportunity. About 2 years back, I was in Delhi for field work for a client of mine, and there was heavy smog, and the visibility was less than 100 meters. I started my work at around 8:30 in the morning, was in the field at around 6 o'clock, but during the course of my field work, I could sense my eyes were burning. I neglected that. The moment I reached the hotel, the eyes started burning, especially my right eye, it started burning even further. And to give some relief, I rubbed my eyes. Yes, it gave me relief, but only temporary relief. Again, the burning sensation started, and like a fool, I rubbed my eyes more vigorously. And the eyes again gave me temporary relief. Then I rushed to the nearby chemist, picked up a bottle of Moisol, which is an artificial tear generator, instilled 2 drops in my eyes, and again 2 drops before going to bed. It definitely gave me relief. But in the morning, my eyes started burning again. So immediately went to stage 2. What is the stage 2? I asked my wife to take an appointment with an ophthalmologist. And the moment I landed in Ahmedabad, I went to the ophthalmologist. The doctor was kind enough, and he did not make me wait much. He examined me for about an hour with various sophisticated instruments. And finally, he said, take this Hypersol, which is sodium chloride eye drops, and ofloxacin eye drops, and instill them 3 times a day and come to me again after a week. I dutifully adhered to the treatment and went back to the doctor after a week. The doctor asked me, how are you now? I said, better. And then once again, he examined my eye. And then he came out with the verdict. Vivek, that is corneal abrasion. I did not understand what he meant by that, corneal abrasion. So what should I do, doctor? You continue with Hypersol and ofloxacin for a lifetime. But only thing, probably your vision of the right eye may be impaired. And that made me emotionally disturbed. And the doctor is asking me to instill Hypersol and an antibiotic, ofloxacin, for a lifetime. Really, I was emotionally disturbed, but more than me, it was my wife. Of course, the doctor was a very, very, very senior doctor, a very competent doctor, but what was lacking in his communication with me was empathy. Not only empathy, even sympathy. He was talking to me like a robot. And the moment I came out, my wife said, let us go to another ophthalmologist for a second opinion. We went to a second doctor for a second opinion. He also said the same thing. And then he said, the only other option is corneal transplant. And then he said, don't go in for corneal transplant because the success rate is not very high. It's just around 18%, and you have to continue to live with an impaired vision in your right eye. That again, now I was a complete mental wreck, and more than me, it was my wife. But fortunately, he prescribed me another product which is called Refresh Liquid Gel. Refresh Liquid Gel, which comes from a very, very reputed company and one of the leading ophthalmologist company, not just in India, but across the world. That is Alargan. And he said this to continue ofloxacin for the next 1 week, Hypersol for the next 15 days, the next 6 months, but you'll have to continue with Refresh Liquid Gel for your lifetime. And again, the same verdict from him: you'll have to live with an impaired right eye. Refresh gel. I require 3 bottles every month, 197 rupees for a bottle. And who's taking care of me? It's my wife who's taking care of me. But what I missed here most, at all these stages of the patient journey, I could not receive any emotional support from the doctor nor from a pharma company. And that gave me a lot of emotional distress. And that is why I said how an ophthalmic company lost an opportunity. Do you think I will ever be loyal to Refresh Liquid Gel, or will I ever be loyal to Allergan? Definitely no. The moment I find a better substitute for Refresh Liquid Gel, I'll change. I'm not at all brand loyal to Refresh Liquid Gel. I'm not at all loyal to Allergan. Why? Because they did not care for the patients. This is where I would suggest why setting up patient advocacy groups is a necessity in India. Today, it's my wife who's taking care of my eyes, instilling Refresh Liquid Gel into my eyes 2 or 3 times a day, and often scolding me if I don't adhere to the therapy. And today, fortunately, you have artificial intelligence. You have software as a service, and leveraging artificial intelligence, the doctor, the SCP can make sure that the patient, at every stage of the patient journey, he is delighted. Have you heard about Gary Kasparov? He was one of the greatest chess players in the world. And for a number of years, at least for 7 to 8 years, he was continuously the world champion. There was no greater chess player the world has produced than Boris Spassky. And he was pitched in a chess match against an IBM computer, Deep Blue. And this was in the year 1997. IBM had developed a supercomputer which pitched the computer against Gary Kasparov. The match was played. 3 matches were drawn. 2 were won by Deep Blue and 1 by Gary Kasparov. And you know the reason for the success of the IBM Deep Blue computer? It is because of the enormous data which was fed into it. More than 2 million moves of Gary Kasparov and the other leading chess players were fed into that. And supercomputer had superb analysis within it, data within its brain. And that is how it could defeat Gary Kasparov. And in a very recent article of March 2021, Gary Kasparov writes, Harvard Business Review of March 2021, he writes, AI should augment human intelligence. AI should augment human intelligence, but not replace it. Now, what has this particular match to do with the patient centricity? The big data and analytics which we have, the healthcare systems are increasingly getting hyper-connected, which means a gold mine of data is available not only with the SCPs, with the pharma companies, and they can ensure patient delight at every stage of the patient journey. AI-enabled advanced analytics results in better prognosis and better treatment outcomes. Variable technology, it enables the SCP to monitor our health parameters continuously. I was talking to you about doorstep. It helps IoT. It helps the caregivers at home in patient adherence. Day by day, technology is helping the patients in better care. It is also helping the caregivers at home. Again, because of artificial intelligence, fraud and abuse during medical claims have been reduced or can be detected easily. Artificial intelligence and IoT can provide a 360-degree understanding of the patient in a single view. And why should pharma listen to the voice of the patient? For the simple reason the company derives its revenues from the patients. Why should a pharma company exist? I took this line or borrowed this line once again from Simon Sinek. Start with why. Why should a pharma company exist? A pharma company should exist to see that the patient is delighted at every stage of the patient journey. Pharma co should listen to the voice of the patients. So the pharma companies and even the doctors, they are aware of the unmet needs of the patients. No decision about me without me. What does this mean? NHS. What is NHS? NHS is National Health Services. National Health Services is a body which was set up by the UK government way back in 1947. And NHS is responsible for the health care of the patient. 95% of the patients, they are reimbursed through, I'm only talking about the British citizens who are reimbursed through National Healthcare Services. And the recent dictum is no decision about me without me. No decision about me without me. So what is this no decision about me without me? It means it doesn't mean that the patient is going to dictate to the doctor what medicine to prescribe or what should be the line of the treatment. I'm not saying that. The NHS dictum, no decision about me, it only means treat the patients like your peer. With the communication between the doctor and the patient should be peer-like communication. The onus is on the SCP to provide accurate information to the patient. And when accurate information is provided to the patient, that will engage the patient in all the decisions. The doctor has to engage the patient in all the decisions. And as a result, this will result in better cooperation, better adherence, and this will lead to better patient treatment. Why is the voice of the patient so important? So F&D can also develop products to address the unmet needs of the patients. That is what I said at the beginning, how F&D can become a stakeholder in the patient journey, because F&D can develop products to address the patient's unmet needs. Pharma products are made for patients, so it is essential that a drug development incorporates the patient's views, and you need to have patient-focused drug development. And for patient-focused drug development, a pharma company really doesn't require huge investments. You only have to listen to the voice of the patient. For example, a survey report of BCG across 5 markets, hospital consulting group. What were their observations? Some of the observations are so simple, and even a small company, say of the rank of 150, can put this into practice. For example, one of the observations that patients get confused. Why do they get confused? Because tablets and capsules, they have similar sizes, similar colors. The survey further said that the most distinguishable factor is the color of the tablet, the color of the capsule. If this is heard by the F&D, it can make the patient happy, and this is again patient-centric. Look at this old lady. Do you think it's really possible for her to swallow a whole tablet? She'll naturally crush it. But what about the tablet or if the tablet is enteric coated, film coated, or worse, it is a bilayered tablet or a sustained release tablet? Just imagine the lady crushing a sustained release tablet. Will it have the same efficacy? This is where the F&D can play a role. And as I said, for looking into all these unmet needs of the patient, you really need not have huge investments. Voice of the patient in drug development is becoming more and more important. Listen to the feedback to fine-tune products and deliver value. Observe how patients handle secondary packaging. Sometimes the secondary packagings really put a lot of stress and strain in the patients. For example, here is a patient who is trying to open a bottle of refresh liquid gel. To pierce a hole, he has to twist the cap in a clockwise direction. The bottles are opened, the cap is normally opened anti-clockwise, but he has to twist the tablet and the cap, right, putting a lot of strain, and he has to see whether the hole has been pierced. And this exercise takes around at least half a minute to quarter of a minute, and have to do it 3 times in a month. This is a small video to show, okay, for a normal patient like me, it's not a problem. But suppose he's a patient with arthritis, patient with joint pains, and he has to put in the effort which you see in this video which follows. It took this patient on an average about 45 seconds to 1 minute just to pierce a hole, and that too with a lot of physical efforts. These are the things which a patient, which a pharma company can hear. These are the small things which the F&D can easily resolve without huge investments, which runs in millions and millions of rupees. Patients are a driving force. Patients don't want to just receive medication. Tomorrow they want the partners to be partners in the development of. What do patients want? Will pharma deliver? Thank you very much. And I'm now open to questions. I'm stopping share screen now.
Thank you, Vivek sir.